Hello and welcome. My name is Marva Ward. I'm the National Product Educator for the Now brand in Canada, and I'm delighted to be able to speak to you today about cardiovascular disease. This particular presentation says a preventative approach, and yes, I'll certainly give you a lot of information about prevention, but it can also be an alternative approach as well. So the supplements that we'll be speaking about certainly can be for prevention, but also they can be looked at for recovery as well. Cardiovascular disease encompasses a number of different, or can encompass a number of different health issues, specifically to the cardiovascular system, or that affects the cardiovascular system. Hypertension or high blood pressure, atherosclerosis or hardening of the arteries, heart attack, stroke, peripheral artery disease, coronary artery disease, congenital heart disease, which is typically something that occurs due to a birth defect, and it can occur later in life, but typically is often based on a birth defect initially. And heart failure. There's congestive heart failure is a gradual weakening of the heart muscle, and fluid starts to build up in the body, in the liver, the lungs, the intestine, and the feet and the legs, and ultimately this leads to congestive heart failure. It is the leading cause of death in North America. In Canada, 38% of individuals who pass away are related to one degree or another. They're passing away because of cardiovascular disease. 9 in 10 Canadians over the age of 20 have at least one risk factor, and 4 in 10 have 3 or more risk factors. We're going to talk a little bit about that as we carry on. Aboriginals and South Asians are at an increased risk for cardiovascular disease, and this is from an article that I've given you the URL for as well. So what are the causes? What are the primary risk factors, primary risk factors? It truly is, for the most part, a man-made dilemma. This is self-inflicted, and it has to do with our diet, abnormal lipid levels, increased LDL, triglycerides, these are cholesterol, low HDL, which is the good cholesterol. Lifestyle, sedentary. We think about the heart being a muscle. If we're not moving around, our muscles are going to get weak, no matter which muscle you're talking about, and the heart isn't any different. Our sedentary lifestyle, the risk of stroke by 50%, obesity, tobacco use, high blood pressure, excessive alcohol use, diabetes, 2 times the risk of developing cardiovascular disease. Stress, what can we say, or what can we not say about how stress affects us? Absolutely, in the heart. You have beta receptors in the heart that are there to accept adrenaline, and to ensure that when you're in a state of fight or flight, that you're able to run. And this constant bombardment of adrenaline into the heart can slowly destroy the heart as well. Poverty, increased risk of heart attack and stroke, again probably related to stress and lifestyle and diet, etc. So you have many different risk factors within under the umbrella of poverty. Medicine, there's certain medicine that causes can affect the heart, and genetics. And one little mention about the microbiome, or our gut bacteria. There is a gut bacteria called trimethylene oxide, and this is created in an environment where carnitine is present. It will take the carnitine from the diet, for example, and it will create this from the bacteria and the carnitine. It will create TMAO. Now, what TMAO does is it enables cholesterol to burrow into the artery walls and build up in plaque. But there really is a big caveat to this. TMAO does not form with individuals who have really good gut bacteria. It typically doesn't form unless people are eating a lot of processed meats, and it typically doesn't form in it's more so an issue with men than it is with women, and it typically does not form unless the individual has a genetic propensity to heart disease. So these are some things to consider, because certainly it isn't the carnitine that's the culprit. It's more or less the condition of that individual's microbiome within their gut, and if they have good bacteria or not. Metabolic syndrome is a number of different health issues that are said to lead to strokes and heart disease, etc. And this is something that the medical community looks for with individuals when they come and get their yearly checkups. Simply looking at their blood pressure, their fasting blood sugar, their waist circumference. I know I went to the doctor about a year ago, and that's one of the things that they did was measure my waistline. Good cholesterol, good and bad cholesterol. High cholesterol is also a risk factor, and high triglycerides. So on this slide, what I've done is given you the blood pressure 130 over 85 or higher is a risk factor, blood sugar 100 or higher, waist circumference 35 inches for women and 40 inches for men, and good cholesterol lower than 1.3 millimole per liter, and triglycerides 1.7 or higher. And these are the risk factors. So when you go to the doctor and you're seeing this as your picture of health, then there would probably be some recommendations in altering your lifestyle, and it probably would be a good idea, because ultimately then your risk for heart disease and stroke is a lot higher. Of course, inflammation is something that we have to look at when we're looking at cardiovascular disease. Yes, it's the hallmark of atherosclerosis, low-grade inflammation, and however, it really contributes to a lot of other aspects that the medical community is starting to realize as well. C-reactive protein is one of the markers. Osteoprogerin is involved in the regulation of a key inflammational marker, NFKB. Now, NFKB is cardioprotective, specific to one situation where there is an acute episode of lack of oxygen to the heart, and this particular inflammational marker seems to be protective. However, it promotes heart failure when it's occurring on a long-term basis. It does this by eliciting signals that trigger chronic inflammation, other inflammational markers, interleukin 6, interleukin 1, tumor necrosis factor A, etc. And this is a situation where it leads to cell death. In slide number 8, speaking about the sudden death of cardiovascular disease, it accounts for greater than 50% of all coronary artery disease deaths. Most of the patients who suffer from this sudden death are not high risk with the basis of established criteria for heart disease. 55% of men and 68% of women have no clinically recognized heart disease before the sudden death. Half of cardiac arrests exist in people with normal levels of cholesterol, and a quarter exist with individuals with no recourse factors whatsoever. Well, overt recourse factors, because what are the reasons for this? Yes, inflammation is one of them, and perhaps hardening of the arteries and blocked arteries, but another one is key nutritive deficiencies. And if we think specifically about the role of electrolytes and minerals with the function of the heart and the regulation of the heartbeat, we're looking at calcium, magnesium, potassium, and sodium. It's said that particularly people between the ages of 40 and 50 that suffer the sudden death, cardiac arrest, where they're not able to be revived, it has a great deal to do in most cases with the very, very low levels of these particular nutrients, but also the improper use of them. One of the recommendations is taurine. Taurine is vital for regulating the heartbeat, for monitoring and directing the use of calcium, magnesium, potassium, sodium within the cells of the heart. And it helps balance these electrolytes and minerals as well in the heart. And so it is certainly a recommendation that, number one, you take a look at your mineral status. And number two, if you're suffering with any kind of irregular heartbeat at all, that taurine should be your go-to amino acid to help regulate your heartbeat. It's a matter of about 3,000 milligrams of taurine per day that will keep your heart beating at a regular rate with which it should. Nutrient imbalance of dietary trace minerals, as I'd mentioned, including alterations in serum cholesterol and triglyceride levels, and the production of oxidized serum lipids, which I'll speak a little bit more about in a moment. This is specifically from Health Canada as well. Vitamin D is an antihypertensive, so vitamin D will help to regulate your blood pressure. It's a strong regulator of renin-angiotensin system, preventing the rise of blood pressure. This is particularly important with individuals with diabetes as well. One of the theories that certainly the naturopathic community embraces is Linus Pauling's unified theory of human cardiovascular disease. And it really speaks to the structural aspect of the arteries. Collagen. Collagen is the most abundant protein in the body. It accounts for more mass than any other protein put together. Vitamin C, with the amino acids proline and lysine, are essential for the formation of healthy collagen. There are at least 14 different types of collagen, but the most common that are used in the body, type 1, makes up fibers found in connective tissues, as you can see here in skin, bone, teeth, tendons, and ligaments. Type 2 are the round fibers around cartilage. Type 3 form connective tissues that give shape and strength to organs, such as the liver, the heart, the kidneys, etc. And type 4 form sheets that lie between layers of the cells in the blood vessels and the muscles in the eye. This again from Jim English and Hyla Cass in a nutritional review. So the unified theory of human cardiovascular disease, again supported by some research that Dr. G.C. Willis from Canada observed, that plaque always forms nearest the heart, where blood vessels and arteries are constantly being stretched and bent, rather than being spread out evenly throughout the entire cardiovascular system. So this starts to give us a little bit of a clue that there could be some damage within those areas. Plaque deposits occur in regions that are exposed to the highest blood pressure levels as well, such as the aorta, where blood is forcefully ejected from the heart. In 1985, a team of researchers verified that plaque only forms in the areas of the artery that become damaged. And so why do they become damaged? And this is something that the unified theory of human cardiovascular disease is trying to prove how these become damaged. Tiny cracks open up and expose strands of amino acid lysine, which is part of collagen, and into the bloodstream. These strands initially attract LPA, which is a very thick sticky form of cholesterol that's attracted to lysine. Drawn to this break, LPA begins to collect and attach to the exposed strands. It's covering the strands to try to seal up the split that has occurred. Linus Pauling announced that the deposits of plaque seen in atherosclerosis were not the cause of heart disease, but were actually the result of the body trying to repair the damage caused by long-term vitamin C deficiency. And he believed that this could be a very low grade of scurvy, possibly. When arteries become weak and they begin to rupture, the body responds by gluing them with the LPA to prevent a slow death from internal bleeding. And so it's really a protective measure of the liver and the body. Conventional triggers of plaque formation, such as homocysteine, oxidized cholesterol, or inflammatory cholesterol, are actually just an additional symptom of scurvy, according to Linus Pauling. So we certainly know the really horrendous symptoms of scurvy, but nobody would ever have thought to put it to linking it together with the breaking down of our arteries and ultimately oxidized cholesterol, etc. Studies confirm that when animals are deprived of vitamin C, and this is another really important point, that their bodies respond by increasing LPA, all animals, and it forms plaque deposits to strengthen the arteries and to prevent vessel ruptures. So is it truly the deficiency in vitamin C? I think it's an interesting hypothesis and certainly worth considering. The little pictorial here is showing you normal arteries, early stages of fatty streaks, and again calcified plaque, and then ultimately, as you get to the very end, it's myocardial infarction, where you're having a heart attack and complete obstruction. So typically, your allopathic community is giving you a preventative intervention by giving you medication, lowering blood pressure, lowering cholesterol, and beta blockers to help with stress and to help so that the heart isn't exposed to the stress. Cardiovascular episodes have a standard treatment, and in the World Health Organization has come out recommending that they incorporate a methodology called pharmacogenomics prior to implementing standard treatment, because one size does not fit all. Individuals who respond very well to the medication, there's a whole group of other people who do not, and really that's really what the image is depicting here on slide number 18. Pharmacogenomics is the study of how genes affect a person's response to drugs, and a new field combines pharmacology and genomics to develop a safe recommendation of medications and dosing that's tailored for that particular individual's genetic makeup. This, to me, is really makes a great deal of sense, because as we've seen, some medical interventions for individuals are fantastic, whereas others it actually accelerates their demise. Genetic variations in individuals with cardiovascular disease influences the properties of the medication, where genetics and biology factors influence the efficacy or the danger. And this is something that, again, the World Health Organization is recommending that the medical community take a look at. Shortcomings in the current call for a new and more effective approach in medication and in dosing. Now, whether this is going to occur, I don't know, but treating according to the individual genotype, genetics play a key role in the patient's response to the treatment. And I've given you this from the World Health Organization. It's an interesting PDF and paper, and worthwhile looking at. The pharmacological approach to cardiovascular disease is blood thinners, um, blood thinners for irregular heartbeat, and atrial fibrillation. Well, I'm going to give you a lot of others that we can do if you're specifically looking for blood thinners. But if you're looking at trying to regulate the heartbeat, as I mentioned earlier today in this presentation, that taurine is where the go-to is taurine that will reverse irregular heartbeat in many, many cases. Vasodilators, you're looking at something where you want to lower blood pressure. Beta blockers, as I'd mentioned, stopping adrenaline from going into the beta receptors within the heart. Aspirin for the onset of heart attack. Calcium blockers for angina and high blood pressure. Digoxin for damaged hearts. It strengthens heart muscles. I talked initially about congestive heart failure, where the heart is damaged, the muscle is damaged. Well, they use digoxin to try to keep and strengthen the heart. Diuretics to treat water buildup. And there is something now that is really, it is the Rambo of a new class of cholesterol-lowering drugs, which is something hopefully too many people do not have to take, but this is a pretty detrimental pharmaceutical. And I've written out the full name here. It's PCSK9, much easier to say. What I'm going to propose today, and I'm going to show you, are a number of different nutrients that we can use that do the very same things that these pharmaceuticals do, but without the detrimental health issues. And that's really where my approach is going today. Nutritive intervention, I think this speaks volumes, and we should be shouting it from the rooftops, is to reduce inflammation. If we reduce inflammational markers, you've got 50% of the game, or even maybe 75% of the game you are winning. Weight reduction, lower body mass index, excessive body fat, particularly in the abdomen, supports chronic inflammation. Consume healthy fats, high fiber, high antioxidants, exercise. They say exercising a half hour 5 times a week is going to help keep the heart strong and the muscle strong. Supplementation, and that's really where I'm going to really focus going forward. Vitamins, minerals, antioxidants, and amino acids. What are we addressing? We're addressing inflammation. We're addressing supporting the structure of the heart, cholesterol, etc. These are the supplements I'll speak to you very briefly about today and how they work in conjunction to supporting a healthy heart and healthy cardiovascular system. Green tea catechins. The catechins in green tea have been studied extensively, and particularly for their ability as an antioxidant, lowering blood pressure, anti-inflammatory, blood thinner, and lowering cholesterol as well. I've given you a URL for study in PubMed. 200 milligrams of ECGCs with 80% catechins in our 400 milligram of EGCGs. Simply a matter of taking one a day. Curcumin. We have so much scientific research showing that it's anti-inflammatory, antioxidant, anti-carcinogenic, anti-thrombotic, and cardiovascular protection overall. It's a natural blood thinner as well. And in fact, most nutritives, most nutrients, and particularly herbs, are natural blood thinners. Again, giving you the URL that speaks to this. Omega-3, 1 gram per day of EPA and DHA is effective as a blood thinner, effective treatment for a heart attack, prevention of sudden death due to heart attack. Many studies show that if we have higher levels of EPA and DHA and we still have a heart attack, we're less likely to die from that heart attack, simply because of the EFA status within the body. it is really a prevention of heart disease, and I've given you a URL that supports this as well. MK7K2, calcification of the arteries increases with age, and often when we look at hardening of the arteries, we think that it's cholesterol, but often it's not. Often it's calcium. And calcium is a component of atherosclerosis. So what MK7 does is it triggers the removal of the calcium where it should not be, in the arteries, in tissue, in joints, and it sequesters it back into the bone. So you have twofold of a complement here. You have, not only are you reducing your atherosclerosis status, but you're also helping with your bone density status as well. MK7K2, the reason recommended MK7 as opposed to MK4 is that it lasts longer. The half-life of MK7 is 48 hours, where the half-life of MK4 is 2 hours. So that sort of gives you an idea of you wouldn't be taking as much, as often, and it's extremely effective. Ubiquinol, or CoQ10, it supports energy production. It's a profound antioxidant for the heart. It alters the natural history of cardiovascular illness. I just get so excited when I see this. It alters the natural history. So if you're taking CoQ10, it is a profound preventative. It inhibits LDL cholesterol oxidation, inflammation. And it is an optimal cellular and mitochondrial function because it helps the body make more ATP, which is our energy source. I've given you the URL for that as well. Vital supplement when taking statin drugs, and one must take 200 milligrams of ubiquinol. This is what is shown to be the dosing, that a minimum dosing if somebody is on statin drugs, because statin drugs stops a full cascade of metabolism, one of them within the cascade that it stops is the creation of CoQ10. CoQ10 is vital for a healthy heart. Apple pectin, I love apple pectin. It is a fiber, and that's really what we're talking about here, is just increasing your fiber intake. But because it helps with a number of different things. But it's said to reduce blood pressure. It reduces cholesterol, and it has anti-inflammatories as well. And the reason that I'm drawn to apple pectin is because it also is a heavy metal chelator, more so than other fibers. Pycnogenol, French maritime pine bark. At the very bottom of this little slide, I've given you a URL from Life Extensions, and pycnogenol is quite profound at its effect in preventing and reversing cardiovascular disease. 100 milligrams per day. A combination of CoQ10 significantly reduces cholesterol, stimulates nitric oxide production, which means it will lower blood pressure, and studies show it has a sharp reduction in the activation of NF kappa B. I spoke about that earlier today, earlier in this presentation, about being a major problem in cardiovascular disease. And it inhibits plaque formation as well. Pycnogenol, for anybody worried about cardiovascular disease, certainly should be an herb or a supplement that they are even cycling throughout the year. L-arginine is a powerful vasodilator. So if you're looking to lower your blood pressure, all of the studies indicate 3,000 milligrams 3 times a day will lower the diastolic and systolic blood pressure as effectively as your pharmaceutical option. There's the URL that supports this as well. There were over 30 studies that were done that supported this as well. Taurine, as I'd mentioned, the utilization of calcium, magnesium, potassium, and sodium, the effect in controlling arrhythmia and irregular heartbeat simply by helping the body utilize these electrolytes and minerals more efficiently. Lowers blood pressure as well. It's 3,000 milligrams a day, as I'd mentioned. Lysine inhibits plaque formation, protects against plaque rupture, and thrombosis, and it is really the foundation of the unified theory of human cardiovascular disease, along with vitamin C, anti-inflammatory, antioxidant, and it is absolutely is said to be deficient with individuals with high cholesterol and hardening of the arteries, etc. Red omega is simply our red yeast rice, and it's 1,200 milligrams a day, which is really the minimum of, if you're looking at slowing cholesterol down initially to try to bring the body back to a state of health, then this is a very good way to do it for a short period of time. Ours contains supportives, CoQ10 and fish oil, and red yeast rice is simply a natural nutritive that slows the production of cholesterol in the liver. PQQ is a really recent supplement that we have launched, and it is like a CoQ10. It's a coenzyme nutrient, but it is so profoundly effective for cardiovascular disease. It supports the replication of mitochondria within a cell without the cell replicating. So what this will do is that it will provide a lot more energy for the heart, and it again is said to involve in cellular growth and development, differentiation and survival of cells as well. It's a powerful antioxidant, and it's 20 milligrams per day that have shown to be very effective for both cardiovascular as well as heart. Ours also contains acetyl L-carnitine and B12. Astaxanthin. We look at astaxanthin for cardiovascular support for a number of different reasons. Astaxanthin is the red pigment that's found in different strains of algae. It will decrease cholesterol, the bad cholesterol, LDL, and the triglycerides, and it increases HDL, the high-density lipoprotein, which is the good cholesterol. It is a profound antioxidant, so it protects against free radical damage. It reduces C-reactive protein, thus reducing overall inflammation. And the induction of cardiac events shows that astaxanthin protects the myocardium against damage, the muscle, the walls and muscles of the heart. I've given you two different URLs that supports all of what I've just stated. So earlier in this presentation, I spoke about what the allopathic community will offer you as blood thinners, vasodilators, etc. And what I'm going to show you now is what you can use as far as supplements are concerned in every one of those in those issues. For example, blood thinner. Most all herbs, as I'd mentioned, thin blood to some degree or another. Curcumin, garlic, pycnogenol, CoQ10 as a supplement, cayenne, omega-3 fatty acids we know are blood thinners. Vitamin E is as well. Taurine supplement for a regular heartbeat, as I had mentioned. Vasodilators, L-arginine, citrulline. Together, they are a fantastic alternative to pharmaceutical vasodilators, as I spoke to earlier today in this presentation as well. Garlic, grapeseed extract, celery. If you're juicing, 4 stalks of celery per day will lower your blood pressure as well because of constituents within celery. Vitamin C, hawthorn. Beta blockers. Anything that's going to stop the stress response, it really is a beta blocker, essentially. Anything that supports the adrenal glands, tyrosine, 5-HTP, Relora, rhodiola, B vitamins, all of them have a key role in either controlling the stress response or stopping it, GABA, for example, or either regulating the body so the body doesn't react in such a disastrous way or destructive way. Magnesium, lots of magnesium. Aspirin in the onset of heart attack. Well, they've shown cayenne, a teaspoon of cayenne in water. If you can get it down the individual, I know it wouldn't be all that palatable, but at least it has the same effect. It stops a heart attack in its tracks as well. Calcium blocker. angina or high blood pressure, magnesium and hawthorn. If you look and read about hawthorn and its effect with angina or lowering blood pressure, or even if look at this particular slide for damaged heart, hawthorn is really effective, and even studies have shown it can reverse damage to the heart. L-arginine and L-carnitine, and don't be afraid of L-carnitine simply because of the IMAO that we spoke about earlier. It is for the majority of individuals, L-carnitine is cardioprotective. Diuretics are water pills that are used to treat the swelling that's often the water buildup that might be caused from high blood pressure. Hibiscus, green tea, hawthorn, dandelion, horsetail, and parsley. Now this proprotein convertase subtilsin Kexin type 9, PCSK9 inhibitor. This is really the last resort for people, but it's the last resort on many levels. Hopefully, with the combination of many of these supplements and lifestyle, nutrition, and exercise, something like this will be averted. Taking this type of a supplement will be averted, or not a supplement, pardon me, a pharmaceutical. I want to talk a little bit about Mimi Garani, a medical doctor. She is a cardiac specialist and surgeon. She's the founder of the Scripps Center for Integrative Medicine. And her story is really interesting because she was a dedicated allopathic cardiovascular surgeon. And she was I guess coerced, the way she puts it, to participate in a study that was based on not pharmaceuticals, not putting in stents, nothing like that, but simply looking at monitoring heart disease, maybe even reversing it by lifestyle, nutrition, and exercise choices. In her words, she said that the results were astounding. She reluctantly participated in something that now she is a key individual that champions this type of a medical response to cardiovascular disease. Her choice to continue with this methodology has resulted in the reversal of many cardiac diseases under her care. And really, it really is an integrative medicine clinic that looks at all possibilities and all ways of treating cardiovascular disease, not just the allopathic method. She received the Linus Pauling Functional Medicine Lifetime Achievement Award in 2012 and the Bravewell Physician Leadership Award for Integrative Medicine in 2011. Quite a remarkable woman, and as I say, the Scripps Center for Integrative Medicine is running and very successful. It's out of La Jolla in California. Cardiovascular support, I've given you a list of all the possibilities specific to the Now brand. Slide number 35 with the CoQ10s, the pycnogenals. Probiotics, simply looking at our gut bacteria as well. And also the amino acids, the arginines, carnitines, taurines, lysines, etc., and the essential fatty acids. Just a reminder about our Now Productology. This is a Now University exclusive for retailers, 60-minute training sessions on a variety of different topics that range from amino acids to xylitol. They are free to all retailers. Every 60-minute training at the end has a certificate of completion that you can print out for yourself, and they really are valuable trainings. They offer a lot of information and something that would be worthwhile for you as a retailer. nowuniversity.litmos.com for sign up, and then the ongoing access to the courses, the last URL. And that concludes my training for today on cardiovascular disease. Once again, my name is Marva Ward. Thank you very much for joining me today.